Thank you very much for having me, Jonathan and all the organizers. Really stellar meeting, very much aligned to where all this needs to go. It's the first time that I'm attending the full one. Very happy to be here. Thank you. So I was asked to talk about patient activation and how it might be part of innovation. And for this, we're going to go very briefly over what's the definition of patient activation, what's actually known in people undergoing dialysis, how can one increase activation, or can one increase, and then could it be an ingredient for innovation? One of the patient activation definitions as outlined here, that's the one that that resonated with me, and I hope you like it too. It is more than what means being activated. It is the readiness, willingness, and ability to manage one's own health and health care. So there is a timely question in there, the capability of readiness, there is a capability part of it, and a willingness. And that certainly from person to person is different. Can it be measured? Yes, it's called the patient activation measure, and it's been around for almost 20 years. One way of what we often talk about, what we want for our patients is we need to understand, and when we talk about knowledge, what we really mean is to understand not only what needs to be done, but in the context of the why, to really deeply understand. Then the skill set really applies to how are we doing this actually? How do we get it done? And finally, a big part, the same way of how we're learning as individuals in any life situations, is the ability to do it and building confidence over time. One way to look at which Dr. Hussein, which is outlined here, the tenets of patient activation then is knowledge is obviously how do we seek information, how health literate are we, and how is the education actually available to us? And is it adequate for how we're learning on our own style? All of this is components to really give patients knowledge. The skill set then focuses more on how can we problem solve? Because with or without disease, life is filled with problems. How can we make decisions? How can we plan ahead? And lately, we all live with goals more than probably when I was a young person. The confidence piece comes then in of having the ability to perform and the actions to really be successful with it. Oh, this has gone a bit faster than I thought. Okay. There is a scale of having a patient being completely disengaged or being completely disengaged in any activity and being on the other side of engagement. One way of thinking about this is on the left side you find somebody who feels lost, who doesn't really have solutions, who has the same problems over and over, who is not doing what he or she should be doing and has been told to do. Not following up with appointments are one of those symptoms that we then see, not following dietary recommendations, and not being able to actually making decisions for themselves. On the other end of the spectrum is then a patient who actually has a good knowledge and understanding of the disease and the management of it, is alert and awake for potential crisis that comes and problems, keeps track of the records, which is part of being more confident and self-fulfilling, follows the advice, discusses problems and solutions actively, not only when they're asked, and then also makes decisions and acts on what's necessary. And so these are sort of the two ends of the spectrum for low activation and high activation. So can one measure patient activation? Yes. In 2003, coming out of the University of Oregon, now called Insignia, comes a company that actually has developed a 13-item survey, 13 questions only, so that's always good, brief and short. It scores anywhere between 0 to 100 and divides people into 4 different levels. Very interesting and very needed. There's also an activation measurement for the care partner, especially when we talk about home and taking more control of our life with dialysis. And it's available in multiple languages. So here's the survey. And due to the small print, I cannot really read them, but I wanted to go into the question 6. I'm confident that I can talk to my doctor even if they don't ask. Now, not everybody can do that. There might also be some generational effects, right? There is a power struggle. There is something I'm feeling vulnerable as a patient, and can I really ask? I have relatives, when I talk to them in Germany, they will say to me, no, please don't call my doctor, which to me is a concept that right now doesn't even exist, but it does for these elderly. It's a cousin of mine who's in his 80s. Building confidence. So the questions are very simple and very easy to answer. So PAM has been utilized, just not that much in our field yet. But insurers, for example, have looked at that for a long time. And what they see is that there is very different utilization patterns for patients who are low activated versus high activation. And we actually looked into this as finding potentially a way of having another tool set to help that we characterize a patient in a way that we can develop other tools dependent on that activation level. So level 1 is the disengaged one. It's sort of, I would say, my parents' generation. The doctor does everything. I don't really have to do anything. There's full trust, and my physician will tell me everything that I need to do. Then the level 2 is still, well, I could be doing and being more part of this team, or actually being part and doing more for my health. And the activated style is really then level 3 and level 4. Level 3, taking action, being part of that team that takes care. And level 4, obviously, being in full control. So what do we know about PAM in dialysis? Due to the time limit, I will only show you one study from outside of the US. There have been some studies. One comes out of Belgium and one out of the UK. I'll show you here the UK study and then share our data here from our organization. So there was a PERM survey in more than 900 patients, a total of actually more than 1,500, almost 2,000 patients. Some on hemodialysis, peritoneal dialysis, transplanted, or CKD pre-dialysis. When you look at the right column, the total ones, you see the green, and the purple column actually shows you the higher activation level. Apologize. And it comes up to about 60% of those being on that high side. When we look at the subgroups, however, the lowest one is really the hemodialysis, and this is center hemodialysis, with much more elevated levels of 3 and 4, the high activation status of patients in patients who undergo peritoneal dialysis, home dialysis, are in charge of their own care, and the patients who are transplanted. Now, you might say, well, these are 2 points. This could be just a selection bias, obviously, and could tell us that, yes, of course, those patients who are more activated by themselves choose more home dialysis versus the others. The other question is that this is important to us then also when we develop tools to hopefully get patients into that activated level, if we believe that this is helpful to patients, what would we need to do? So let me share now our satellite experience with you. We had actually interns for a summer, it was 2 summers ago when we could still go in centers, and they went to a number of our centers, a total of 10, in Northern California and in Texas, and they gave the survey to 925 center hemodialysis patients. And what you see here is that overall the high activation level was about 1/3 to 2/3. So the majority was low activation level. When we looked at the age groups, we saw that the high activation was more prevalent in the younger ones, less than 55 years old, and then trickled down to about 1/3, well, almost 27 to 73% in the population older than 75 years old. When we looked at gender distribution, the females had a bit more higher activation levels versus male. And when we looked at education, people with less formal education had lower percentages of high activation compared to people who were more educated. One interesting aspect I thought was to show you this one. We published this last year, that patients who actually had been new to dialysis within 3 months to 1 year, so that's first year, we took out the incident ones, that was a separate study. There were much more activation, high activation. When you looked at, with this survey, these are not the same patients, but these are patients who have been on dialysis for 3 years, there was always a drop to 32%. Now, we all have in dialysis talked about in the last few years that there's this learned helplessness. I've heard this from patients, that they are less activated after 3 years, because what they're asked to do is come to the center at this time, sit down, take the fluids and the toxins off, we give you your drugs, and then please go away, and hopefully everything works out. So these data seem to indicate that what we already heard and learned from patients is actually data-driven here. So then, what about patients new to dialysis, right? I know we want to go upstream with value-based care, and we need to go upstream, obviously, with CKD. But from my role in a dialysis organization, this is the moment when we can, as a provider, make a difference. So what is it like then? We had 182 home and in-center dialysis patients now from 37 dialysis centers. They were all within the first 90 days, and we measured them at the beginning of that time and then again 3 months later. The Insignia people who are experts on this can tell you that it doesn't matter to do this on a monthly basis. That really changes to look over a longitudinal time frame. You look after 3 months. And so we found that the average PAM score at the initiation was at about 65. Now, 65 is right in the middle of that activation level 3. Our center patients had one of 57, 56, and that is very much at the low end of that level, right? So quite different points. 43% had low activation, very different from the other one. Home patients had higher activation. So these are now in-center and home patients, again, verifying what the UK study already showed. And the higher activation was found in patients who were younger, had higher education levels, and had longer pre-SRD care. And that obviously it's not the egg or the chicken. It could also be the reflection of that they were already more activated before. Also, I would also say in our country, we also need to always ask, did they have access to care or didn't they, for none of their particular, not self-induced reasons. So this is a bit of a complex data point, but again, we had trouble. These kind of data are tough to publish, guys, because that's not yet the mainstream research, but we finally got it published, and I want to focus on this slide here. What happens over time? So on the left side here, you see the baseline levels of those 182 patients. And you see the percentages and, the numbers. So a third are in that level 4. More than 65% are in level 3 and 4 at the beginning. When you look at the right side, we see the follow-up, which was done 3 months after the patients had the baseline. And the gray shaded areas here show you the amount of patients, followed in the brackets by percentages, who stayed in the same level they were 3 months before. And the first take-home message is, well, it changes, because not everybody is there. And the second level is then, if you just look at level 4, you can see that only 65% were staying in level 4, and the others decreased. So that's very important for us to develop interventions. It is not a static measure, right? Things happen in life, and they impact us, and how we react to that is individually different. So now, how can we improve activation? No data whatsoever. So this is just our framework for this. In fact, I will not say this as my framework. This is actually what my colleague, Dr. Wael Hussein, has worked on. So yes, leveraging technology to do this. Right now there is no tool. There is something called Calibri. They have some of these engagement measures, but nothing specific for dialysis. So what we think, and what we actually do now, clearly tailored education is important. People learn at different levels, and we have just started in dialysis in the kidney community to do this. Coaching techniques. When we are doing professional stuff, we get coaching to get better at what we're doing. We should consider this for disease process as well. Self-management trainings have been shown in a number of areas, in diabetes, in CHF, to help tremendously the patients to be having a more control over their life and the disease. Peer mentoring. We're just starting. We know that this is important. I've heard it from the patients over and over. We're implementing this at Satellite now to just see that when patients talk to other patients, what we actually find out what's really important to them. involving them into doing rather than talking to them. The proms and prems, I'm so glad that Matt has such successfully put this together also for home dialysis. This is important, and the only reason this is not more prevalent right now is because it's not so easy. It's not a blood test. It's not just draw blood, measure it, and have it. But those are the real metrics that need to be addressed in order to do this. And finally, technology can help. Now, it's for you, the patient advocates, actually, to tell us, is this something you want to do over Zoom or over telehealth? Is this a program? Is this an initial talk to each other, to somebody who knows? Those are the things we need to work out if we're thinking about improving this. So right now, all it has taught me is something that I have hopefully helped advocate at Satellite for the last few years, that individualizing care is important. Not one patient is like the other. None of us is the same. We have similar dreams and hopes, but we want to execute on them very differently as individuals. Access to care dependent on patients' needs, not dependent on what the system provides. An interdependency of patient activation and innovation is likely true. Patients who are more innovative, who are more activated, are more eager to take more control, and the others are probably not daring. I'm not sure if I didn't know dialysis that I would want to go home and stick 2 needles in my arm every night. And yet that's required in what we're asking, and yet I would do home hemodialysis if I had to go on dialysis. The patient voice and design is really the critical element. And again, to the organizers here, you have executed on this in a way that I have not seen before. So thank you for that. The right innovation, and then always asking patients know best what they need. Thank you very much.